Hello, everyone, and welcome to our IVF webinar. It's a Monday evening, and I'm very happy to be back once again with another interesting topic. And of course, another wonderful guest. As you can see, Dr. Belén Marqueta is with us. So, hello, Dr. Marqueta. How are you feeling tonight? Hope all is well.
Really good, thank you.
Thank you so much for joining us tonight. This is your first webinar with my IVF Answers. So thank you so much for accepting our invitation and, of course, bringing this amazing topic and, of course, this amazing presentation that you have prepared for us on fertility preservation for younger women. This is a topic that I always like to have simply because, of course, with new possibilities that we have nowadays, it's wonderful to know and give this I would say information out there that if you are not ready to simply have a baby, you can still have a chance to simply postpone it. There are options nowadays. So I'm very, very happy to be able to also be a part of this whole IVF webinars project and of course bring those topics to you. And we will definitely start with Dr. Marqueta's presentation, and afterwards, as always, your favorite part will start. It will be your Q&A, so don't forget, if you have anything that you would like to ask, all you need to do is just type those questions into the chat section, and Dr. Marqueta will definitely answer them for you. Don't hesitate. Anything there's on your mind, just go ahead and do it. And of course, I'm your host, Caroline, and I just want to mention that, as probably some of you know, my IVF Answers is a part of European Fertility Society, and we are here every single day to bring some of the most popular topics, but also the topics that are not discussed as much. And I think that fertility preservation is one of those topics that is not yet discussed that much. And I'm very happy to be able to simply discuss it with you today. And as always, we will start with the presentation right now. And afterwards, there will be time for your questions. And remember, it has been recorded. So if anyone has to leave, I hope not, but if anyone has to leave, don't worry, you will have a chance to watch this again tomorrow on our site. And that will be it from me. And let me just add that Dr. Belén Marqueta, she is the gynecologist specialist in human reproduction at Eugin, and she is right now live from Barcelona, right, Dr. Marqueta?
Yes, good night. Good night, everybody, and thanks, Caroline, for your introduction. For me, it is a real pleasure to be here tonight with you. And as you all know, we'll be talking about social fertility preservation tonight. So let me start with the presentation. Okay, social fertility preservation has become a topic, okay, a really important topic in our media during last years. And for understanding why it has become so important, well, we have to take into account several factors that took place in the last half of 20th century. Women started to work out of their homes and good contraception methods appeared. And these factors allow women to control their fertility. And they were able to decide the time to get pregnant. And this is a point that we had never had before. So from the biological point of view, the best age to get pregnant is between 18 to 30 years old, more or less. But unfortunately, this is the period of time when people usually develop their professional careers and their personal life. And this could drive to a conflict of interest. And consequently, there will be a high percent of women who voluntarily will delay their motherhood. In fact, in next slide here, you can see, according, these are data from United Nations, in the last registered 40 years, the motherhood delay is generalized in North America and in European countries. And the mean age for the first birth in Europe in 2010 was 28.7 years. But what is the problem? I mean, what happens if we delay this motherhood? Okay, with the age, what we are going to have is a progressive decrease in the oocyte quantity and quality. And this means that we are going to have a lower ovarian reserve. And it's important to take into account that this is not a disease, okay, it's a physiological aging of the ovary. So, how can we test our ovarian reserve? Well, what we can do is we have to take into account two things. One is the quality of the oocytes, and the second one is the quantity. So, unfortunately, we don't have any markers for checking the quality, but we absolutely know that age is going to decrease the quality of our oocytes. And on the other hand, for assessing the quantity of the oocytes, the number of oocytes that we have, we can do a blood test and we can check for our anti-Mullerian hormones, or we can do a simple ultrasound and make an antral follicle count just to check if our ovarian reserve is or not normal. And from what age does this ovarian reserve start to decrease? Well, as we said, the best fertile period in women is between 18 to 30 years old, more or less. And from this point, fertility starts to decline slowly. We can see that on the graphic. And it's going to get faster after 35 years and faster after 40 years old. And this is going to mean two things, okay? One, that there will be more difficulty to get pregnant for this woman, and also that there is going to be a higher risk of miscarriage related to maternal age. And why are we going to have this risk? Okay, this is explained because of the quality of the eggs. When we talk about the oocyte quality, we refer to the oocyte competence, okay? So the loss of this oocyte competence is mainly due to some chromosomal abnormalities that are going to appear in our eggs with the increase of the maternal age. So these chromosomal abnormalities will involve the difficulty to the embryo for implant inside of the uterus, and also that we are going to have embryos that are promptly arrested. And clinically, this means having recurrent implantation failures and recurrent miscarriages during the first trimester of pregnancy. And as I already say, I just want you to remember this is not a disease, it's just a physiological ovarian aging process that we, all women, are going to have. So, okay, given the situation, what can we do and how can we stop our biological clock? Well, nowadays, what we can only do against this age-related fertility decline is an elective oocyte vitrification of our eggs. And just see how it works. This is how we do the treatment here in Barcelona in our clinic. What we do is to contact to the patient the first day of the cycle, and we ask the patient to start an ovarian stimulation treatment from the second or the third day of their cycles. This ovarian stimulation treatment is performed with some hormones, okay, with subcutaneous punctures. And we ask the patients to come to do the follicular checks, okay? We do these follicular checks with ultrasound, and also we do these follicular checks with blood test. And we start with, monitoring how the follicles of our patients start growing. Depending on the response, we tell the patients how to continue with the treatment and when to come to a second follicular check, and usually when to come to a last and third follicular check. When we see that more or less all the follicles are big enough, then we give them a last injection that what it's going to do is to induct the ovulation. And this way we know that 36 hours later, we can see our patient in the operation room for perform the egg retrieval. So egg retrieval, we do it always in the operation room and always under anesthesia. It's a sedation. And what we are going to perform is the puncture of every follicle, always under ultrasound guidance. So we are going to be able to take the liquid that there is inside of the follicles. We can take this liquid into our laboratory and select the eggs that are inside of this of the liquid. And this way, our biologist can perform the cryopreservation of the eggs in the laboratory. So how many eggs do we recommend freezing? What is considered for our patients an optimal outcome? Well, that will depend always on your age. Okay, here what you can see is a graphic. Okay, what we are going to see in this graphic is that each curve is going to show the probability of having at least one live birth at home, depending on the age of the patient and depending on the number of mature oocytes that we obtain the day of the follicular puncture. So the youngest is the patient, as you can see. The lowest is the number of oocytes required for having a baby. So here you can see again the importance of performing this treatment with a proper age. What kind of women come and vitrify their oocytes? Well, this is our data, it's internal data from our clinic. We started in Eugin group in Barcelona, we started this elective oocyte cryopreservation program in 2011. And we call it a time freeze program. And since that moment, we have performed more than 1,500 cycles in our patients. When we ask our patients why they were doing this treatment, mostly said that the reason was they didn't have a partner in that moment. The second reason was because of their professional careers, and also some of them manifest that they had a late childbearing wish. Here you can also see our data from our group, and what you can see is a decline of the mean age at the time of the oocyte preservation. So in 2011, the mean age from our patients was 4 years old, and in 2018 it was 36.9. It's true that during 2019 there was a soft increase, but we are really happy for this evolution. Why? Because we know that the main factor to determine the motherhood changes is the age of the oocyte. So we know that women that undergo nowadays to this treatment with us have a better prognosis than the ones that perform this treatment 8 years ago. And this is probably because nowadays we have more info and we can give more info like with these webinars to all of our patients. So who returns to attempt to get pregnant with these vitrified oocytes? Well, in our data, from more or less 1,500 patients, we had 123 that have come to use them, and we have performed already 131 transfers. So we have a rate of returning of an 8%. And the mean age at the moment of the cryopreservation of these patients was 30 years, and instead of that, the mean of age of the transfer was more or less 3 years later, so at 41.2. 4.5 years old. And it's interesting to know that almost 100% of those patients didn't have a partner on the moment of when they performed the cryopreservation. And at the time of returning, more of the half of them had a partner. And this is quite interesting how sometimes you don't expect, but your life can change, obviously. So, does it work? What happens when we decide to use this vitrify eggs? Okay, so if our patients want to do what we call a second part of the time freeze process, what we are going to do is thaw the eggs in our laboratory, and we know that survival rates are really good. Over 90% of the eggs are going to survive. After that, we can perform the fertilization of these eggs with partner or with donor sperm, depending on if the patient has or not a partner. And the fertilization rate is also going to be quite good, more or less 75% of the eggs. And this way, we're going to create embryos, and these embryos have a pregnancy rates that are quite similar to those of the patients that come here and use fresh oocytes. And here what we can see are the pregnancy rates of the patients that come and use their eggs after this time freeze. And again, what you can see is that these rates depend on the patient's age, but depends on the age of the moment when the patient performed the cryopreservation, and not on the moment that the patient is performing the transfer. So again, it's quite important to do this treatment as soon as possible. And it's good to note that obstetric outcomes are similar to those of the general population. So, finally, just a fast take-home message. This is for me the most important of this topic and of this webinar, to remember to our patients that at the end, what is really, really important on fertility is the maternal age. So fertility depends on our age. And this is all from now. Thank you very much for your attention.
Thank you so much indeed for your presentation. Wonderful presentation with lots of details and lots of data as well, which is definitely very useful. And now, as you know, it will be time for your questions. So if you haven't asked yet, go ahead and type those in. I'm not sure if you see Dr. Marqueta, but already there are some questions and I see people are typing in. So yeah, don't hesitate. Go ahead and type those in. This is definitely an interesting, and I always love those Q&A sessions. I'm sure you are going to bring lots of interesting questions. The first question we've got is here. What vitrification media and storage units are you using?
Okay. I'm so sorry, Derek Delansky, but I think this is more a laboratory question, and I have not exactly the info. So I'm sorry, I cannot give you this a good answer to this. So sorry.
Not a problem, of course. We can always forward this, and I'm sure, Dr. Marqueta, you can share this with your embryologist colleagues.
Yes.
Or they will be more helpful here, and they can explain how it all works, and they can provide you with more details. That's not a problem. We can definitely forward this. Okay, but still, thank you so much. Definitely an interesting question. And let's have a look. Okay, next question is up from Lydia. I'm 33 and I have a partner. I'm afraid of being late, but we also don't want to take too long to try to have a child. Is there a maximum of or minimum time limit for using the eggs once it they are frozen?
No, absolutely no. There is not a maximum, there is not a minimum time to use these eggs. And that is why this treatment really gives women the freedom to postpone their maternity and their desire of creating a family until the moment they feel ready for that. And regarding your age, Lydia, I don't think you're late. I mean, you are under 35 years old, so I think that you are in a perfect moment for start thinking into performing an elective oocyte cryopreservation. Yes.
And wonderful. Thank you so much, Lydia, for your great question indeed. And of course, Dr. Marqueta, for your answer to that. All right, the next question is also ready from Kat. If I want to freeze my eggs, how many eggs do I need to freeze? Is there a difference if someone is 35 versus 41?
Yes. Okay, absolutely. Yes, there is a big difference. In fact, during the presentation, we show a graphic, and the number of eggs that we have to freeze depends on our age. Because as youngest is a patient, okay, the lowest is the number of the eggs that she will have to freeze for having at least one baby at home. And this is because with the age, as we explained, there is going to be a decrease on the quantity, but also on the quality of the eggs. So we need to freeze more eggs if we are older, just to compensate a bit the lack of quality that we are going to have because of the maternal age.
Once again, thank you so much for another great question and of course for your answer. And let's have a look, okay? I don't see any more questions at this point, but of course, again, if you would like to add anything, just go ahead and do it right now, as this is your time. And someone again is typing, so we just need to give it a minute and wait for the question. But also let me add that, of course, if you don't have a question right now, but you would like to ask some other questions later on, I will send you a link in a second and you will be able to simply use it. There is an option to get in touch with Dr. Marqueta and her team at Eugin, and I'm sure that they will be more than happy to help you out, okay? So just go ahead and type this in now or later on. But in the meantime, let's see if we do have another question. Yes, there is one more, okay, from Kat. Let's have a look. So, okay, it's interesting again. Is egg freezing covered by insurance? For example, in Spain, there are some countries where egg freezing is still not possible. What are the advantages of doing it in Spain? Thank you so much.
Social cryopreservation is not covered by insurance here in Spain. Okay, this is because at the end is an election for women to do this treatment, so it's not covered nowadays. Okay, for our national insurance. Regarding the advantages of doing here the treatment, well, I will say that, as you all know, Spain at the end is a country with lots of experience in regarding IVF treatments and fertility cryopreservation treatments, just because we have performed these treatments since a long time ago. So I think that we have lots of experience. And we have many clinics that, like our clinic, where we are used to treat patients that live in other countries, and that we can make it easier for the patient to perform the treatment on their countries and give them all the facilities just to come here for perform just the ovarian puncture or just a small part of the treatment.
Excellent. Thank you so much yet again, of course, for a great question, Kat. Okay, let me have a look at the next short question. What is the technique used for that? Yeah, I guess.
Well, I guess that you're asking about the stimulation technique, or I'm not sure. Well, if it's regarding the stimulation treatment, we always do an antagonist treatment. We always induct the ovulation with decapeptyl just to avoid the risk of hyperstimulation. We perform the follicular puncture in the operation room, and we cryopreserve the embryos. Well, the biologists cryopreserve the embryos here in our laboratory in Barcelona.
Wonderful. Thank you so much. And again, I need to wait a bit for another question. But in the meantime, if I may ask just something that I already asked some time ago, do you see that there is an increase of interest when it comes to egg freezing in recent years, or even maybe because of COVID-19 pandemic happening? Do you see an increase that women are contacting Eugin and of course you more and more, and they want to actually freeze their eggs?
Yes, absolutely. During last years, it's true that it has been an increase of patients that want to perform this treatment. And also, as we explained, they are younger, okay? So, which is, we are really happy about that because the prognosis is going to be better. And also, during this last year of pandemic, I think that many women have maybe have had more time to think about their own issues. And we have had an increase of patients that want to do this time freeze treatment with us.
That's definitely wonderful to hear, and that it's spread out more out there, and it's more and more people are simply more aware of that there are some options. And thank you so much for answering my additional question. And so I just one more, also can add one more thing. So is there like a age, like you say, of course you said that until 35 is the best time, but is there like I would say like in your 20s is your best time to try? I mean, some of the women, if they're in their 20s, they might not even think about it yet. So is there like a, I would say, perfect time?
Well, the perfect time at the end has to be, well, we have to assess every patient. At the end, we don't have to forget that this is medicine. So we have to evaluate individually every patient just to check if it's a good moment for performing or not this treatment. Anyway, in a generalized way, I would say that in the 20s, maybe it could be too early, in the sense that it's true that the ovarian response is going to be really good, but also the probabilities of having a family, if you still are in your 20s, the probabilities of having a family during your 30s are quite big. So maybe it's not a good idea to perform it too early. I would say that a good moment to start to think on this, if the patient has not a disease or a lower ovarian reserve, etc., is between 33, 34, 35 years old.
Wonderful. Thank you so much for adding that. This is definitely interesting and good to know, and a great take-home message as well. Thank you so much. Okay, Dr. Marqueta, next question will be in Spanish, so I will not read it, as you can imagine. I think it will be better if you can have a look at it, right?
Of course, yes. Now, it's again a question regarding the laboratory, because well, she's an embryologist, and she wants to know the medium that we use for cryopreservation, the eggs, which is something that I'm really sorry, but I don't have this info, just because I just work with the medical part and not with the laboratory part. So, but definitely I will ask our biologist just to know which is the brand of the medium that we use for cryopreservate the eggs. Yes.
And again, that's not a problem at all. But thank you so much indeed for taking an interest and joining us tonight. Okay. And this is something that, as I've mentioned, we can definitely forward to you and your team. I'm sure you will be able to help them out. Okay. Next question is right here from Natalie. What is the upper age limit for freezing your eggs? I am 45 and already have a few at Eugin, but want to better my chances.
Okay, so what I understand is that this patient has already performed a time freeze cycle, and she already has some eggs frozen here. She wanted to perform a new cycle of time freeze. We have like an internal limit that is 47 years. But we don't recommend usually. I mean, as I said at the beginning, we just have to assess individually every patient because we cannot generalize. Every patient has an ovarian reserve that is different from the patient that is next to her. So we always have to see the patient. We have to perform a complete study of the patient. We have to perform the ultrasound, the blood test, and everything just to assess if it's really going to be worth it or not to cryopreserve the eggs. But usually, I mean, over 42, 43, 44 years old, we know that the quality of the eggs is not going to be good. So it's not our recommendation to perform these treatments because we know that they are not going to work at the end.
Understood, of course. Thank you so much. And I have a follow-up, okay, from the very same patient that we got the question previously. So my anti-Mullerian hormone are about 3.6, same as it was when I was 42.
Yes. Okay. Well, first of all, we need to know always are the units on of this anti-Mullerian, because we can give the results in 2 different units and the numbers are quite different. Okay. But as I said during the webinar, it's not just the quantity of the eggs that matters. That obviously is important, and this quantity can be evaluated with the anti-Mullerian hormone or with the follicle antral count. But also, it's quite important the quality of the eggs. And unfortunately, we don't have any markers to assess the quality of the eggs, but we know that age is going to have really a high impact on the quality of the eggs. So even if we have a good ovarian reserve, the quality of these eggs may not be so good. And so this is going to lead to implantation failures if we create and transfer embryos, or to miscarriages during the first trimester.
Perfect. Thank you so much for adding this information as well, and of course for your advice. All right, next question is up. Okay, that might be our final question. Okay, so if you have any left, go ahead and type those in. We will be slowly finishing. The question is definitely interesting. So, do you also have patients who decide to freeze eggs because they are trying to conceive and it's been unsuccessful for some period of time, although they have a partner? Or is it better to simply freeze embryos rather than eggs?
Well, this is a very, very interesting question. But and here there is a legal part that we have to take into account. Okay, if we freeze eggs, these eggs are our eggs. I mean, is the women, okay, that has these eggs frozen in our laboratory. But on the other hand, if we freeze embryos with a partner, these embryos are from these 2 people. Okay, so at the end it's not the same with in a legal point of view, in the sense that if you want to use your eggs, you can use them whenever you want. You don't have to ask for permission. But instead of that, if you want to use the embryos that you have frozen with a partner, you have to know that you both have to sign the consent form for performing a treatment. So at the end, they are not just yours anymore. But we don't have to forget that embryos are more advanced cells than the eggs. So the survival rate to the freezing process, to the thawing process, and to the manipulation of the embryos, they are going to have a better response in our laboratory than the eggs. So at the end, we have patients that do so many different treatments. There are some patients that want to freeze eggs and embryos with a partner, but they also freeze some eggs because they have so good ovarian response that they have good numbers for performing both treatments. There are other patients that just freeze embryos because they have a partner and they want to have a child with this partner, and they go ahead with the freezing process of the embryos. And on the other hand, we just have patients that are just waiting to see if they one day can have or not a baby with their partners, and just in that moment they freeze the eggs, and they keep trying, or they talk to their partners and have some future plans.
And wonderful. Thank you so much indeed. This is definitely a question that it's interesting, because it's good to know that other ways. Yes. So thank you so much for explaining that it's not only like black and blue, I would say. It's just simply other. You just have to imagine what's best option for yourself, and based on that, you can just go ahead and do it. So definitely, thank you so much, Kat, for that incredible question, for sure. Okay, let's have a look for next question from Natalie. Is there a long waiting time for donor eggs? And do you do some kind of matching between biological mother and the one having the child?
Okay, a long waiting time, and not really. I mean, we have a really good program of eggs donor here in our clinic in Barcelona, and we have many donors, in fact, because the program is quite good. And of course, yes, we do matching between the biological mother and the one that is going to have the child. Okay, we always perform physical matching. We have a team, is called our matching team, that is specialized on performing this physical matching between the donor and the receptor of the eggs. And we can add also a genetical matching if the patient decides to do it. This genetical matching is for some recessive genetical disease, and we can add it to the treatment just to avoid having a child affected from one recessive disease.
And excellent. Thank you so much indeed for yet another interesting question, although a little bit off topic, but of course, I'm very happy that you have asked that. Thanks so much for this. And that might be our final question. Okay. Someone is typing, so I don't want to leave before we make sure that we have answered all of your questions. But of course, as I've mentioned, if you haven't asked your question yet, I will simply add the link here, and this is the link where you can actually ask more questions, and that will be directed to Dr. Marqueta and her team at Eugin, so you can use it. But of course, if you have any more questions, this is your time to do so. Go ahead and type those in. If not, we will be finishing. And there's one more question. Okay, so let's have a look at it. Have you had any results post-thaw via PGS? Yes, I'm an embryologist too. Okay, thank you.
I'm sure, absolutely sure that yes, we have some results after the PGS, but I don't have the numbers. And we don't always advise our patients to do the PGS. We just advise them depending on their ages or their clinical or medical history, but not always we do that treatment.
Excellent. Thank you so much indeed. This has been, again, interesting question. And of course, as I mentioned, we will be finishing. However, everyone, thank you so much for joining us tonight, for your amazing questions indeed. And of course, Dr. Marqueta, for answering all of those questions. And before I let you go, anything else you would like to add?
For me?
Yes, of course.
No, just thank you, and because it's been a pleasure. It's always a good experience to share contents with our patients or with other colleagues. And thanks for giving me the opportunity of being here tonight with you.
Thank you so much indeed for joining us tonight, for all your incredible questions and your thorough answers to this as well. And I just want to mention that this is actually our first topic on fertility preservation this week, because I'm not sure if you've seen, but there are some upcoming events on that particular topic this week. Tomorrow, actually, there is another doctor that will be here with us from Eugin, Dr. Clara Coloma will be here as well, and she will share some success stories from the patients that actually used frozen eggs for their treatments. So if you haven't signed up yet, just go ahead and do it. And of course, once again, just want to tell you that this has been recorded, and of course you will have a chance to find it on our site, My IVF Answers, tomorrow, but also on our YouTube channel. And if you go there, you know there are over 2,000 subscribers, and I'm sure you will find it very, very useful. And all I can say, Dr. Marqueta, it's been a pleasure to have you. Thank you so much for explaining every single detail tonight. And thank you so much indeed. It's something that I always look forward to. Those are the kind of topics that should be spoken more about. So thank you so much for bringing this. And everyone, have a lovely evening. Dr. Marqueta, it's been a pleasure. I just hope that it's going to be our first webinar with you, but of course not the last one. So as I always say, till our next event, okay?
Okay, thank you.
Perfect. Thank you so much. Take care, everyone, and hope to see you tomorrow. Bye.